Hey bitches, it's me, Pallavi, and this week we're going to talk about deodorants and antiperspirants. No, this isn't what should have been a required part of every 7th grade health class. This is dirty science. Sweat glands on your body secrete sweat or perspiration, which is your body's method of regulating how hot it is. Unfortunately, sweating doesn't work for all people. Nothing can be done to save Rihanna from how hot she is. When sweat evaporates off of your skin, that creates a cooling effect, like what happens at the end of all of my relationships. Dogs don't have sweat glands, so they just pant, which has the same effect. When bacteria on your skin metabolize the sweat, that's what causes BO, or body odor. These bacteria are just taking a shit on your skin. Think about that while you're too good to eat ass. Antiperspirants are a subclass of deodorants that seals the sweat glands in your armpits, thereby preventing the sweat from reaching the surface of your skin. Antiperspirants use aluminum and other compounds to achieve this effect, while other deodorants, which I'll just refer to as deodorants, block underarm bacteria from actually acting on sweat and metabolizing it, thereby preventing the smell that this breakdown causes. So is there a link between deodorants or antiperspirants and diseases such as cancer and Alzheimer's? Well, let's talk about the components of these products that are in question. Aluminium-based compounds are found in antiperspirants, and they're used to form a temporary plug in sweat ducts to prevent sweat from flowing out of your body and onto your skin. Some scientists believe that because you apply your antiperspirant to your armpits, and because breast cancer often starts at the top of the breast near the armpits, that antiperspirant chemicals could be the reason for these tumors. They believe that aluminum-based compounds in antiperspirants could lead to the development of breast cancer or directly affect the breast tissue by mimicking estrogen. Estrogen is a hormone in your body that assists in developing female sex characteristics. Female sex characteristics include breast development, the ability to text back, and not being a little bitch about commitment. No studies have confirmed the aluminum and breast cancer hypothesis. And a 2014 study showed that there's no conclusive evidence that using aluminum-containing antiperspirants or cosmetics under the arms can increase the risk of breast cancer. Moving on to parabens. Parabens are a preservative that are often used in food, cosmetic products, hygienic products, a number of different things, at safe levels as approved by the FDA. Because parabens are in so many everyday products, they can be found in most people's urine. Some folks are worried about the cumulative effect of parabens over time because they have been found in breast tissue. Paraben mimics estrogen, that hormone we were talking about, by binding to the same receptors that estrogen binds to. Scientists hypothesize that this binding could trigger a series of reactions that could lead to breast cancer. In a 2004 Campaign for Safe Cosmetics (CSC) study, 19 out of 20 women were found to have 5 different types of parabens in their breast tissue. But this again brings us to causation versus correlation. Just because parabens are correlated with or found alongside breast cancer doesn't mean that they caused it. There's no current link indicating that parabens cause breast cancer. And most antiperspirants available nowadays are paraben-free, even though your cosmetics, food, and pharmaceuticals probably still have some. A 2002 study didn't show an increased risk in getting breast cancer for women who used antiperspirants and/or deodorants. This study was based on 813 women who had breast cancer and 793 women with no history of breast cancer. In 2006, a study with 54 women who had breast cancer and 50 without also showed that there was no link between breast cancer and the use of antiperspirants and/or deodorant. There was a study in 2003 that was a retrospective study, meaning it asked women questions about their history of using antiperspirants and deodorants. This study found that women who started using these products earlier in life or used these products more frequently were at a higher risk of developing breast cancer, but these results were inconclusive because other factors could have influenced the outcome. Let's talk about aluminum and kidney disease. There's some fear surrounding how aluminum affects the kidneys. Years ago, after dialysis, patients were given a drug called aluminum hydroxide. Their kidneys could not process the aluminum fast enough, causing it to accumulate in their bodies and potentially leading to dementia. After this, the FDA required that all antiperspirants contain a warning label. Ask a doctor before use if you have kidney disease. But this warning was only meant for people whose kidneys functioned at 30% or below, which is stage 4 or 5 of chronic kidney disease. Do you think that's what he meant when he said the chronic? The chronic! Leslie Spry of the National Kidney Foundation basically said that unless you're straight up eating it, you're not going to absorb enough aluminum through your skin to affect your kidneys or lead to dementia. Yo, is that what happened to those dumbass girls in Axe commercials? Were they only allowed to eat Axe on set and then they got dementia, went crazy, and found the incels in those commercials to be attractive? The Someone free those poor girls! Another fear that people had about aluminum was that it could lead to Alzheimer's disease. The Alzheimer's Association's official statement regarding this is, studies have failed to confirm the role of aluminum in causing Alzheimer's disease. Don't you think it's pretty insensitive of the Alzheimer's Association to tell us to just forget about it? Okay, that one was bad, I'm sorry. Poor taste. So in conclusion, is there any link between antiperspirants and or deodorants and breast cancer or dementia or Alzheimer's? Fucking no! Stop smelling so bad. It's LA, it's hot. Stop wearing natural shit that doesn't work. Just because it's natural doesn't mean it's better for you. Do you know what's natural? Tobacco. So can or should you use deodorant? Can you? Yes. Should you? Yes. Especially if you're my fucking Uber driver. Don't make me be trapped in that vehicle with you smelling like shit. I don't give a shit if you just came from yoga.